Yeah, so great to have you all once again. I want to take this opportunity to thank all of you all for joining on time, and we'll go ahead with today's topic. And today we have with us Dr. Suraj Singh. Dr. Suraj is part of our team at Rahat. He's a psychiatrist, consulting psychiatrist on our team, and we're so glad to be, discussing this topic on eating disorders. It's very often misunderstood, or maybe because of social media and different perspectives, it's not understood quite well. So I think it's good to have this conversation and good to understand how we can help somebody whom we suspect to, be having this kind of a problem. So we'll understand the struggles around food, the body image, and also how it is impacting mental health currently. So Dr. Suraj Singh will help us with that. And I'll just put you on spotlight. Yeah. Oops, sorry, did I get somebody else on spotlight? 1 minute. Huh? Yeah, so Dr. Suraj Singh, you can put your, I think your camera is not on. That's why it's not coming.
Not ma'am.
Is your camera off?
No, ma'am. It's on.
Okay, then. Okay. So I'd request all of y'all, those who have joined today, that if you all have questions, to please keep putting it in the chat box, and at the end we'll have a time of Q&A. So if there are things that y'all are confused or y'all want to know more about it, we definitely take it at the end of it. Okay, so we will just look at the different types of
Ma'am,
what are the yeah. So what are the different types, and just in brief, and then how we can treat that, So and then we'll go to different questions. So sir, if you can just let us
right.
know, just discuss that with us first. What are the different types of eating disorders?
Yeah, sure. Thank you, ma'am, for giving this opportunity. So, eating disorders, we usually do see in our clinical practice, but it often gets overlooked because of some other diagnosis, or sometimes just missed as nobody pays much of an attention towards it. So, there are mainly three types of eating disorders. One is anorexia nervosa, the other is bulimia nervosa, and third is just binge eating. Most commonly in our clinical practices, which we usually see is bulimia nervosa. So, based broadly, I can just describe what all clinical features are seen in that. So, we usually see the person or the patient suffering from this. They usually have bouts where they eat a lot of food. It can be like vomiting. So, they force vomit, they induce themselves to vomit out. So, laxatives or purgatives so that they remove it out. So this is a common feature where the intake is high, but also some compensatory measure which they take to remove the excess food. So the weight overall of such a patient will be maintained. They will be in the normal range or slightly higher range. So sometimes the people around them are not able to identify that they must be suffering through this, because on social occasions they do eat normally. In fact, they behave normally, but when they are on their own or when they escape the situations, they do these compensatory measures. Another eating disorder which is called as anorexia nervosa. Comparatively, here we see lesser cases of it as compared to the West. In these cases, the patient overall intakes very less food. So their overall quantity of consumption or the portion size reduces drastically. Their weight falls into the very lowest range of the normal range is required, much lower than that. And many a times they are brought to the hospital because of the medical complications they suffer, electrolyte disturbances or micronutrient deficiencies, vitamin deficiencies, and then it's identified that they are suffering to this. And the last is the binge eating pattern. So binge eating and bulimia are similar, in which binge eating also there's a lot of food consumed, and it's mostly related to the emotional states. Any type of stress, any mental health problems they suffer, they compensate it by food. But here it is not associated with something else like vomiting or going using laxatives. It's just associated with eating and possibly a lot of guilt associated with food. Yes.
Yes, yes. So, can you tell us, like, what are some of the things, like, that we can perhaps understand? Because sometimes we think that eating disorders is either people with who are very thin or maybe
Hmm.
very obese, those extremes is what we think of. But sometimes a normal looking person can also be having this disorder. So, what are some,
Hmm.
hidden signs that we should look for?
Yes, correct, ma'am. So it's usually not related always to the weight. Even a normal person might be having these the disorder or symptoms. So warning signs for us to watch as hidden signs is certain changes in their behavior. If the person has started becoming withdrawn, he's not much interacting with everybody, or even if he's avoiding social occasions. And a major thing you'll understand is this is not the usual. Behaviors have changed. Even around food, certain behaviors might change. They will say that they do not enjoy this food, which they previously used to love, or they may show lack of interest or no interest in any good things or food which they used to like.
Mm-hmm.
The portion sizes might also change. They might eat less or they might eat more. So, very subtle signs and nuances which can be missed.
Correct, correct, correct. And is there any, red flags that people should be looking for, like families should be looking for?
Hmm. Yes, certain red flags is when there are sudden changes in the food habits, when they have stopped eating or have severely decreased the eating amounts. And then you also observe changes in their mood. They're getting very irritable on shorter occasions, or extremely agitated, tearfulness or crying like episodes which are being seen. Certain nutrient deficiencies which also can manifest as weakness or lethargy, fatigue. Even those signs have to be watched for.
Okay, okay, okay. And how can a family member kind of distinguish between someone who's just just fussy eater, or just those kind of a thing, or somebody who's using food to manage some stress, because we know that we hear of lot of times people having stress eating, they when they're stressed out, or whether they when they want to cope,
Hmm,
or when they are sad. So how
hmm.
can we distinguish the two?
Mhm. So most important criteria is, ma'am, to understand how they were all through the years. So if we know the person previously, how was their eating habits, how was their food habits, how was their behavior in general. If somebody is a fidgety eater, they might mostly always have certain criteria, certain peculiarities about food. But has it started recently? Have they started avoiding food? Have they started avoiding specific types of food?
Hmm.
And if not, if they've started eating, are there specific types of food which they've started eating more? So especially carbohydrate rich foods. So people in stress or when there is this emotional aspect of eating, brain craves for carbohydrate dense foods. So almost like a fried foods or sweet foods. Have they started eating more of it? And while eating, what kind of emotions are they feeling? Do we observe them just eating for the sake of it, or eating slowly, mindfully, understanding the taste, those kind of things. Even if you observe somebody focusing a lot on food, on their weight, and previously the person was not like this, but now they have changed. So these are certain signs to understand the difference.
Right, 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 right. Um, so there's one another aspect that is very often seen in terms of eating disorders, and that is what the culture or the society wants. There are some certain expectations. I know, especially for women and for
Mm,
young girls, that people want to look in a certain way. Maybe they're comparing themselves with the actresses of the current generation, or whatever they see on social media.
yes.
So like how can we like kind of understand the why of this eating disorders, and It's increasing now. I think in the past it couldn't be so obvious, but now there is an increase of such things.
Correct. Yes.
So,
So,
um,
yes, ma'am. More or less, it must be lesser previously, or it must be missed, and now it is more. One, because like you correctly pointed out, the social media now easy access to that. So yes, there's a lot of comparison, especially with younger girls, adolescent, teenage girls. They too tend to compare it online or with their peers. For example, if we are aware about a situation in Korea, so there, it's beauty standards, a perfect body weight, the skin, it plays a very important role for them. So many of them do actually develop these eating disorders in order to maintain the weight. They try to compensate it, and or either they reduce their eating or compensate it. In India also there have been a cultural factor. So especially for female child, even and households or families also, they've always been told to maintain a certain way, or to look in a certain way, or to not eat much, to behave in a certain way. So it stems from all this. It starts with that, about the eating disorder. Another
right,
important factor, which is the image problems, ma'am. Body
correct.
image distortions also can cause this.
Right, right, right. So, how does a distorted body image actually feel from the inside? Like you must be seeing many cases,
Yes.
or clients like this. So, what do they come and tell you? Like, what are the
Mm.
things that they?
Yes, ma'am. So now, ma'am, as per our textbooks, also body image distortion or body dysmorphia is classified as an illness. It comes in the spectrum of OCDs, OCD related disorders, obsessive compulsive related disorder. So usually these patients, they always have this sense of belief that they are not looking good, or a certain body part of them is not looking good. Can be anything, can be related to fat, even if they are not. People keep telling them that they are fine, they are good, but they are not able to remove this belief. They have this strong belief, or like an overvalued idea, or a thought that no, they are not fine, or some part of the body is bad, some part is overweight, maybe the fat is showing. So that thought within them, that belief tends to be very strong, and doesn't go by just positive reinforcements or reassurances.
Hmm.
It can start, ma'am, from childhood. Maybe a person might have been a little overweight or a little fat in childhood or during teenage, and must have been ridiculed for that, or must have been taunted. We also see cases where in families, children are being told by their family members itself to reduce weight, or they are not looking good, or they are looking ugly. So that constant thoughts, taunts are always in their mind. So even after they tend to lose the weight, or they tend to look good, that feeling doesn't tend to leave them.
Yes, yes, very true. So, you mentioned something about obsessive compulsive disorder. So, we usually have the concept that obsessive compulsive is when you're, constantly washing your hands or keeping yourself clean and those kind of things. So, can you explain that? Like, how does that look in this scenario, in an eating disorder scenario?
Yes. So, ma'am, in for example, there the compulsions are about washing. Your the obsession is about the body part, the thoughts that this is not right or this is not fair. The compulsions can be constant checking in the mirror. They can be constantly checking themselves, checking their part. They can be also in the form of camouflaging, so hiding certain things. They may tend to wear loose clothes, tend to wear darker clothes to hide if for a body part. To the extreme levels, they may also go for cosmetic surgeries, various procedures, and even the part of the bulimia where they overcompensate by vomiting or using laxative. That again comes as a compulsion, because they eat, they feel that guilt that no, I will become fat again, or I'm already fat. Compensate it by vomiting or using laxative.
Right, right. So basically, what you're trying to say is that this eating disorders is not really about the food, but it's about a need to feel in control.
Yes,
So, can you kind of like give us something,
yes.
some
Mm.
more
Yes.
understanding?
So, like, because it starts with the feeling of helplessness, that maybe I'm not good, or maybe I'm not good enough. So that helplessness makes the person feel that they have no control. So they try to achieve this control by controlling their actions. Now, food is something which they can control, either by controlling the portion size, or by removing the excess which they feel has been too much. So this sense of control tends to slightly reduce their helplessness in the first initial phases, but then eventually it tends to keep increasing, and this vicious loop starts where they feel helpless, then they do this, they feel a little better, but then again they feel worse. I've had a few cases like this, ma'am, which I can describe.
Yeah.
Yes, I had a female client, can name her Miss X. She was working in an IT job, and she had a pretty stressful job. There was no working hours as such. There was no fixed meal times also for her, and her boss had been behind her, constant meeting, work calls, everything. And she was overall quite frustrated with how her life was turning out, and she would feel this lack of control, that I'm not able to manage anything or not doing this. So gradually, she, because of skipping the meals time, she would have stopped skipping meals altogether. One meal she would skip, once she would have, and feel better that okay, I did not eat today. I could control that. And in case of where they would go outside, they would start eating or something. She would eat outside, and immediately she would excuse herself and go to the washroom, either to induce the vomiting, or she might be end up taking laxatives. There was also this lot of guilt associated with food she had. So she would feel that I'm again losing control here as well. So I'll have to do some steps with regards to food.
Mm-hmm. Okay. Yeah. So, like now, suppose a family comes to know or they suspect, that somebody must be going through this. Can you share, like, what is the most compassionate way to start a conversation? Because I think first and foremost, breaking that, barrier and talking about it is
Mm,
something. So, how would you like kind of help a
mm,
family member who wants to help their
mm.
close one?
Correct. So first, I would tell them, ma'am, to not directly ask them about the eating habits or the food or any thing related, which they can feel as an attack. Usually, what happens is family members are upset. They also feel upset, angry, so they tend to address it in the those kind of manners that she does not eat, or he does not eat, or he does this, that. So most important is for them to control these their emotions, and first is to just address. So just address what kind of thoughts or feelings their relative is feeling, how they have been, what kind of behaviors they are experiencing. More focus on the emotional aspects rather than directly about the food, about the emotional well-being, the mental well-being, their work, their sleep, those kind of things to start with.
Right, right. Another very important thing that we feel needs to be addressed is,
Mm,
seeking professional help.
mm,
So, because we know that that is a very important aspect of it, like, if they would, okay, go to different people who would give them some tips here and there, but I feel there has to be a combination of different people working towards helping this person. So, can you just share how can we help, like in a
mm.
holistic manner? We just don't want it to be either only medication or only psychological help, but how can a person
Correct.
help be helpful?
Yes, ma'am. So first, we will have to explain them that now seeking help is not any weakness, or it's are weak, or those commonly which people use, unstable or mentally ill. It's not those kinds of things. We like to explain it to them that it stems from a deeper rooted causes. It stems from certain traumas, certain misunderstandings, this ideas of guilt, shame regarding to food, regarding to other habits, and how to come out of it. So I'll tell them that eating disorder is a symptom, and we have to dwell deeper to understand why it has started, how it has started, and how to break this. And it can be only done completely with the client, with the doctor, psychologist, and the family as well. I'll tell them that without their support, it is not possible for the person
Correct.
to come.
Correct, correct. Yeah, sometimes I think family members, play a vital role, because sometimes what I feel is they would kind of tell them, oh, you ate this, you ate that, like a food police, you know,
Correct.
you
Yes.
shouldn't be doing this or you shouldn't be doing that. So that can be a deterrent, I guess, right? For
Yes,
the,
ma'am.
yeah,
For the
yeah,
yes.
for the patient, for the client, yeah.
Yes.
Or very uh, like important aspect from a medical point of view is, would there be anything like would there be an emergency situation, like kind of it's a non-negotiable sign that the family has to seek professional intervention? So can you just help us with that?
Yes, sure, ma'am. So, like we know, because of less eating or overcompensating it by nausea, there can be essential nutrient deficiencies. So, if there is extreme weakness, if the person is not able to get up or not able to do simple tasks, they feel very tired doing these tasks. That is one sign. If they start reporting tingling, numbness of the limbs, of hands and feet, they say the sensations are there. They're not able to lift their hands and feet. That is an important sign. Because of this frequent vomiting, ma'am, there can sometimes be tears in the lining of the stomach. So any kind of blood, if it comes during the vomiting or any kind of blood during spitting, it comes, that is a very warning sign or red sign to immediately seek help. They can also, the enamel of the teeth gets disrupted because of the vomiting. So tingling sensations in the teeth or pain in the jaws, those are also warning signs for them to seek help.
Okay, great. What about, if you want to look at complete recovery, successful recovery, what are some of the steps that need to be taken in a holistic picture? So because we are talking about whole person care. So
Hmm.
can you just tell us how the steps should go, like for a person who's once diagnosed?
Correct. So, ma'am, I would first tell them that it is not just about food, that this just they have started eating normally again. So no, that doesn't mean they've just gotten better. If to understand how and why this had started, so understanding about the person's self-worth, the self-confidence, the beliefs about themselves. Like there is this lot of guilt, shame associated with food or weight gain. To address those things, if there has been any traumatic experiences like bullying or regards to their weight, have they been taunted or told about that, so that we have to address. Underlying mental health also simultaneously, if there is any ongoing stressors, say be it at work, be it at home, so maybe try to understand what stressors they are going through. Some alternative coping strategies, many people use this, like we've discussed, as a coping strategies, as a ways of control, so they feel this sense of control. So we'll have to teach them some alternative coping strategies like journaling, mindfulness, or a simple exercise, simple breathing exercises, where the overwhelming thoughts are reduced and they can then function properly. And they can use alternative measures rather than these things. We have to start with observing the changes in their mood, in their social withdrawal, or any food changes. We observe that they have started changing their food pattern. This will inform the family members also that this is the first step to observe. And then, rather than judgment, to connect with them, to understand them, that we understand your problems and we are worried about you, not directly targeting them or taunting them or shouting them. And then together with the psychologist, with us, making a proper plan, whatever kind of therapy is suited for them, and then we have to use it completely.
Correct. Correct. Yes. Very good. Very good. So, so you want, what you're saying is that it has to be addressed in a holistic manner. It should not be just only medication. So, medication does have a role in this. Does
Yes, ma'am.
medication? Yeah. So, medication, and because most people have a block against medications, saying that
Hmm.
medication can be lifelong, and then the person is dependent. So, is that something that people need to be concerned about? What do
Uh,
you feel about medications?
Yeah, this one we commonly see. It's, I think there's this myth or misconception about medicines, but we reassure them and address them that no, it's only required for the initial phase where maybe the intensity of thoughts is too much or too captivating, and their social life is affected, their functioning is affected. So for during that time, till the time we also start the other measures of treatment, so the therapy, the counseling techniques, the mindfulness, and we tell them that once those things start and you have a regular pattern, medicines will be tapered off and stopped. It's not going to be for a lifelong thing.
Lifelong. Correct.
No.
Correct. Yes. Yes. Very true. Yeah.
Yes, ma'am.
Yeah, so I think that was a quite, I mean, like a comprehensive thing that you've helped us with. I think what I took, like just got a gist was one about observing changes, that we need to observe the changes. We
Mm,
need to keep connecting with them and be compassionate towards what they are having, what are the problems that they're facing, especially the emotions. I think we need to connect with the emotions of the person, and also we need to guide them to the right consultation so that they get a holistic care. So it's not just only medication or only psychological help, but it has to be. And then sometimes a physician also comes in if the person has a nutritional deficiency, so that also needs to be adjusted, or maybe even a diet reference or whatever needs to be done. So
Yes.
yeah, so that I think so. This is really helpful. I think there are some questions. Joyce, I don't know whether your question was answered during the sharing or.
Yeah, the second one was, I wanted to ask was the medication that you were talking about. Do you mean the medication for the physical effects of the bulimia or anorexia, or do you mean medicines for the mental well-being? That's what I was
Mm,
asking.
mm. Right. Medications for both, for deficiencies, if there are vitamin and mineral deficiencies, that we use, and also for the mental aspects. So, in case if there is these excessive thoughts, this shame and guilt, and these repetitive thoughts about body, about low self-esteem, self-worth, so certain kind of this which helps into this. There is a FDA-approved medication, especially for eating disorder. It's an class of
Okay.
antidepressant only, but it works well with
Okay.
eating disorder.
Great.
So, as a parent or as a teacher who works with kids and adolescent kids, is there any way we can, instead of waiting till the point where it becomes anorexia or
Hmm.
bulimia, is there something we can do in the beginning so it doesn't reach that far? Any tips or anything as for teachers and parents and adults who have kids around
Yes.
that you can
So
advise?
first would be, I think, to encourage this mindful eating, and we can observe, as parents, at least we can observe how the kids are eating, meals they are finishing or not. And while eating, it's very important to focus only on the meal and not any other activity. Like ma'am we had discussed in another on screen time and those things also, because that also tends to affect. In case in the routine talks, if we observe that there is too much talk about weight or body or in comparison with those things, we can immediately correct during that time itself, that everybody is different or everything is different, and whatever about the nutrition, we can tell them. Be very careful about, in case if they share something about either they have been taunted or about the weight or something they've been told, so that reassurance that no, if we eat healthy, we do it properly, it's fine. Those things to observe.
Okay, thanks.
Yeah. Yeah, I think it's important to keep talking to the kids about comparing, body structure, because body weight and body structure, it's especially when they're growing. I
Mm.
think that's when the teenage years is when they are very much conscious about their body. So I think that's when these things trigger, I guess.
Yeah.
Yeah. So,
That whatever we see, those are not the ideal standards. It's just been made to appear aesthetic. So whatever ideal standards, the range of ideal standards, those things we can explain.
and I think also probably even self-worth. I think your
Yes.
worth
Yeah.
doesn't come from how you look or what your performance is, but who you are. Yeah, self-worth. Yeah, somebody said that. Yeah. So having a
Yes.
session to boost the self-worth is very important. Correct.
Mm.
Very true. Thank you. That's useful. Anyone
If a
else?
person
Yeah,
and has
self-identity.
esteem, then these things won't happen. The food,
Yeah,
like at least the chances will be lesser, because it does stem from some self-esteem issues, some self-worth issues.
correct. And we must look at it as a something which is deep rooted. It's not just about, like we said, it's not just about the food and the food habits, but it's about some maybe traumatic event or something that they're trying to cope. And they're using food as a coping mechanism, just like people use alcohol as a coping mechanism. So food must be giving them some comfort, and then after that, when it goes overboard, then they're trying
It,
to bring it out
it,
of their system and those kind of things. Multiple. Any other questions anyone wants to ask or have any comments? Thank you so much, Joyce, for those questions.
Okay, I have one more.
Yeah, sure, sure. Go ahead.
Yeah, so again, as parents and teacher and stuff, do you kind of train us as adults to have just like talking about journaling and those kind of things to kind of channel your thoughts and your thing in a right passage? So do you have sessions where you can teach us so we can help our kids? Because honestly, I understand the thing of therapy and all, but it's not always easy to find a
Correct.
therapist or to go to one. And so, I mean, if that's possible, it'll be good because I guess we can also start work at ground level. So
Yeah.
that would be
Yeah.
nice if you can have something like that.
Sure, sure. We'll
Yeah.
keep that in mind. Yeah, definitely. I think the most important thing is listening to them. I think that solves a lot of problems, just listening to what they're trying to say without judging. Because, right, I think currently the current generation is just looking for someone who would just uh, look at them without judging who they are and what they're going through. I think that is a very key aspect. Yeah, but definitely we look at training and those kind of things, definitely.
And we can consider, ma'am, a workshop or something with the team.
Yes, yes, definitely. We can. We can do that. We'll work at it. Thank you for that, Joyce. We will get back to you. So when it's a need base, it's more this. So currently, I'm just looking at what is trending, and then I'm arranging these sessions. But if there is a way where we can get feedback, so feedback forms are sent to all of you. Like I hope it's you all have been getting it by email. So if you all can put that down on feedback, we would love to have it fine-tuned to what is exactly required. Yeah. As parents, not comparing between siblings or neighbors or relatives' kids too helps in building the self-worth. Yeah, that's very true, Annie. Yeah, very true. It's very critical, actually. Unknowingly, we tend to tend to compare. Oh, you're doing this. This is not right, and so that we have to look at a different way to communicate. Maybe what they're doing may not be healthy, but how we talk about it and how we encourage them to take healthy decisions for their habits, eating habits, and those kind of things. Yeah,
And I think this issue is not just for teenagers and all, I feel, because there's
correct,
some, including me, I still have this thing of like, not body dysmorphia, but like, oh, there's certain parts of my body, I wish it was different. And I guess
correct.
as women, I think pretty much most of the women, I can honestly say that most of the women have issues with their own
Yes,
self, and that has been ingrained in us that you're supposed to be of a certain weight, certain height, you're supposed to look this way. Even though you're 50, you're supposed to look like a 30-year-old. So I think there's like a huge things.
yes,
Even now, we have friends who are like, okay, I don't look good, but I'm like, okay, we're still talking like teenagers, but it's not only a teenage thing, it's throughout,
correct,
so yeah,
correct. It's a culture.
it
That's why
is,
it's a cultural
yeah,
and society has, brought it down that this is how you should look. And in Indian culture,
yeah,
of course, it will be different from the Western, but Indian cultures, they do have, comparative ways of your color, your how you uh,
yeah,
do things. Yeah, so those kind of things is something that we need to stop our tracks and rethink what we
yes.
are saying, what we are speaking about, and what we focus upon.
Yeah, because even when we meet somebody after a long time, the first thing they'll say, "Oh, you've put on weight." That's the
Correct.
first thing they would say. And I'm
Yeah.
like, what is wrong with you? Like, that's not even a high. First thing is you've put on weight or you've lost weight. Or it's just the body thing. And it's a very Indian
Yeah.
thing to do. It's a very, very
Yeah.
Indian
Yes.
thing to do, which is like, we need to
And it's so
change this.
embarrassing when it's in the big crowd.
Yeah.
Yeah.
So,
Why don't you try this? And so immediately you'll get a lot of
yeah.
free advices on how you can reduce your weight.
Yeah.
Yeah. Yeah, I think Annie's also put some comments in this day and age. I, as a counselor, have to analyze that parents are the ones who need counseling. We need to do awareness sessions for parents in schools. Yeah. Yes, yes. I wish we could do that. Yeah. I mean, we should start with ourselves and then slowly start communicating. Yeah. Yeah. So thank you so much, Dr. Suraj. I think that's a great, just understanding on um eating disorders and body dysmorphia and those kind of things which we spoke about today. And thank you all for joining. We'll definitely look at how we can train the different people, who are interested in small techniques in how to handle children, how to manage emotions. I think that's a very important aspect. Yeah. So thank you all for joining. It was great. I'd love if you all could send us the feedback. So your feedbacks will come by email. So if you all can just quickly share the feedback enter your feedbacks in the feedback form, we would be grateful.
Yeah.
Thank you.
Thank you so much.
Bye. Bye.
Thank you, Dr. Vinod. Thank you, everyone.
Thank
Dr.
you.
Vinod.
Thank you.
Thank you.